Good afternoon. 20 before 6 is 540, 100.1 WVOC. We are on a health kick this hour. We're talking about HPV last hour, and we can get some information posted up as Bakari Sellers continues his campaign.
All right. I want to welcome a guy to the show now who I think we need to help this fellow with a marketing campaign. Okay. Now, you know breast cancer awareness, right? Everybody knows the pink ribbon.
Right.
The pink ribbon means breast cancer awareness. Mm-hmm. This guy needs a ribbon, because he's trying to get you to do some colon cancer checks. We don't have, what are we getting, like a brown ribbon for him or something? I don't know what we need.
Loud?
Absolutely.
We do blue.
All right, we do. This is Dr. Stephen Lloyd, the man behind SaveYourColon.org, and also the program No Behind, Left Behind.
Yeah. No behind, left behind?
Well, when you think about it, boobs or butts, which is the best bang for the buck?
Is that another? This guy's a poet, too. I love it. Now, you're located right here in Columbia, where, over on Taylor Street?
We're on Taylor Street near the Township Auditorium, 1735 Taylor Street.
And what exactly is the No Behind, Left Behind?
Well, the trouble is too many people put off getting a colonoscopy, and they can sometimes pay with their life for that. A colonoscopy is 50 times more likely to save a life than a mammogram. Mammograms don't prevent breast cancer. They try to detect it early before it spread, but sometimes it's still too late. But with colon cancer doesn't start as cancer. It first starts as a little growth called a polyp. And from the time the polyp is first visible on colonoscopy until it turns into cancer, usually takes well over 10 years.
Wow.
So if we destroy the polyp during the colonoscopy, guess what? You can't get colon cancer. And so colon cancer is more than 90% preventable. But yet it's the number one cancer killer among people that don't smoke. The only cancer kills more people is lung cancer, and we know what causes that. But colon cancer is preventable, and so we have an opportunity to save 50,000 lives every year if we can just do a better job of getting people not to be afraid of that 5-foot-long hose. And I guess we do have a little bit of a marketing dilemma.
Yeah, good Lord. Could you make it any uglier? The 5-foot-long hose. Guess where this is going?
Hey, I didn't say that. Let's
take
that back.
Up.
You said it!
Let's erase it. But people don't realize that it is totally pain-free. We put people totally to sleep here when we do the test, and people wake up and they say, wow, everybody told me these horror stories about this was uncomfortable, and it was a piece of cake.
My tonsils are inching, and what's going on?
There you go. That's right. Your
5
tonsils
feet.
Are still floating.
Now, what age does this need to start at?
Excellent question. We start at age 50 if you have no additional risk factors. If you're at average risk, you start at 50. 95% of cases of colon cancer
Because my doctor was aggressive. He said we should start at 45.
Well, I think the earlier the better. We're finding more and more cancers in the 40 to 50 age group, but it really, the older you become, the more likely you'll have polyps or colon cancer, especially in women. Women get it even a little later than men. A lot of people think this is a test just for men or just for women. It's really an equal opportunity killer. That men and women are both supposed to start at age 50. If you have any polyps in your family or any history of colon cancer, then you start at 40.
You know what's amazing is, and we used to hear these nightmare stories from these guys who have been through this process before, and you had this like gallon jug mixture of the stuff you had to drink, and they said, God, it's awful, and you had to sit there and you can't leave your house because you have to go to the bathroom.
And, the prep is a bad, that there's no way to make it real easy. We just use 10-ounce bottles of magnesium citrate so you don't have to drink the gallon thing, but it's still not much fun. You get up real close and personal to your potty, and you have to have some nice fresh wipes or something.
But he tells me that, it's like this stuff now you get in like a lemon, it's like a lemon water or a grape or a cherry.
You can get
and
any
then
flavor you want.
You got to take some kind of laxative pill, so it's not like you got to drink this concoction that sounded like it would be awful enough.
Yeah, you're right. We've worked diligently to try to make the prep a little bit better. That's the biggest complaint we have is people say, "Ooh, that's getting cleaned out is not much fun." But you only have to do it every 10 years if it's normal, and even if you have polyps, it's usually not any more than every 5 years. So if it's something you have to go through every 5 years to save your life, I mean, when you think about it, 50,000 Americans died last year, and 48,000 of those would have lived if they just had a high-quality colonoscopy.
Well, most of those good old boys Southern Baptists need a good digestive cleanse anyway.
That's right.
Point.
We all need a little cleansing. Get those toxins and poisons out. Yeah.
Now, am I to understand that you will help people who don't have insurance or even a way to pay you?
Well, we make a commitment. We work with a lot of the primary care physicians in the area, and we've made a commitment to these practices that refer patients to us to say, if you have a hardship case or whatever, if you're a regular referral, we'll find a way to get people in. We have what we call the parking lot. When people don't have insurance, we put them on a list, and if somebody cancels kind of at the last minute and we don't have an opportunity to fill that slot, then we bring the people in off the free list. And we also do all the cases for the Columbia Free Clinic, and we do a lot for the American Cancer Society that have hardship stories. You know, we try to find some way to get people done, and we don't want financial barriers to be a death sentence. And it's the most life-saving test in all of medical science.
Wow.
To compare it to mammograms, a colonoscopy is 50 times more likely to save a life than a mammogram. And
good night.
so
Not that we're trying to minimize what a mammogram can do, but
no, mammograms are one. I'm not trying to discourage people from having mammograms. I'm just saying we've got a test, like you said, we need some blue ribbons instead of just the pink ribbons. You know.
Yeah, we have these incredible campaigns about mammograms.
Yeah,
and,
save the tatas. We've got the pink, goalposts
Sure.
and everything.
I mean,
but
pink
we have
baseball bats. We got everything going on.
But we have a test that could save 50,000 lives, and we just don't have people that are advocates for us as doing the marketing. Like, we need to hire Susan Komen for the cure to work for us.
You know, some guys don't want to go to the doctor, guys or girls, don't want to go to the doctor because they really don't want to know what the answer is. Or it could just be the people like me. I don't want to go to the doctor just because I don't want to go to the doctor. I'm not really worried about what I put it off. I'm not paranoid about it, whatever. But if you figure that you go through this procedure, as you described it, you're out. You don't even know what's going on. You're in and out because it's outpatient. As opposed to not doing it, and then you got to put up with having to go to the doctor because you got colon cancer.
Yeah, then you got chemotherapy,
and you got to go
surgery,
you got to go deal with all that,
and then you die.
Yeah, and then you're dead.
Right.
That's even worse.
And what people don't realize is the difference in survival based on what stage you are. If you come in, and even if we find an early colon cancer, if it's an early colon cancer, we have a more than 90% cure rate. But if you have advanced colon cancer, and unfortunately you don't get symptoms till it's advanced, there's a 90% death rate. We do not have any good treatment for advanced colon cancer. If you have colon cancer that's spread to lymph nodes or into the liver, into the lungs, 90% of those patients will die. And so it's such a tragedy. It just breaks my heart when we find somebody that has colon cancer. Fortunately, it's getting rarer and rarer. When we find somebody that has advanced colon cancer and we say, goodness gracious, if you just come a year or two earlier, this would have never happened. And like I said, the polyp to cancer sequence, the time from when a polyp starts until it turns into cancer, taking more than 10 years, it gives us such a window of opportunity to prevent those tragedies. And it's just so sad when somebody puts it off and says, well, as soon as I have my first symptom, as soon as I start bleeding, I'll come see you.
Wow.
Well, don't bother. It's too late.
Yeah.
Well, I think at this point we've made it crystal clear that if you get a colonoscopy and they find the polyp, you're probably going to live.
That's right.
And so go and get it done. You already said that the money should not be a barrier. There's really no reason for people to not get it done other than the fact that they didn't know about it before now.
That's correct. And one thing that we do have to highlight is that not all colonoscopies are the same. We're the only facility in the area that focuses just on colonoscopy. That's all I do. I've done over 30,000 of them, and it's just something that we have a whole team. We have 4 people in the room that help to be sure that everybody's focused on the screen and being sure that we're all looking for those little pesky polyps and finding every one. We pride ourselves. We just finished a huge $400,000 National Cancer Institute study that looked at just how protective is colonoscopy in keeping people from getting subsequent colon cancer. And we had the best statistics that have ever been reported in the entire nation right here in Columbia, and we're so proud, and that's one of the reasons we're trying to get the message out. But there's a simple way that patients can find out how good their doctor is. There's a measurement, which we call the ADR, the adenoma detection rate, and that measures just how often the doctor finds polyps. They've done studies in people that died of something other than colon cancer to find out just what's the likelihood of somebody having a precancerous polyp, and they were startled to find out that over 40% of people have precancerous polyps. But some of them are small and hard to find, and so a lot of doctors only find precancerous polyps in 15 or 20% of their cases, which means that they're missing a lot of them, and that's why some patients still go on to get colon cancer even after they've had a colonoscopy, but it wasn't done by somebody that is as conscientious as they can be. And so
that's all you do. All we do is colonoscopies.
No
we
behind,
got it,
left
doctor.
behind.
SaveYourColon.org is the website, right?
That's exactly right. SaveYourColon.org, and it'll tell you the 10 reasons why you might want to think about coming here, not just the quality that we have the highest ADR, but we specialize just in colonoscopies, and it's totally pain-free.
Appreciate it, Doctor. Have a great day.
All right.
Thank you, Dr. Lloyd.
So
thank you
much.
for your efforts, and thank you for your help with people who can't even really afford to get it done. What a great service for the community.